everyone. Welcome back. This is Justin Abbatemarco, and I just finished interviewing Claire Creutzfeldt and Bob Holloway on their article published in JAMA Neurology titled Medical Forecasting, a Skill Set Worthy of Attention. In the first episode of this Neurology Minute, we discussed medical forecasting in general. Claire dived down and applied it to a particular scenario when patients or family members are asking what are their chances in whatever clinical scenario. How does this forecasting help lend itself to help answer that question?
Medical forecasting is just one of the skills. Another one is obviously communication skills. And we would probably start to answer that question by better elucidating what they mean, what they're actually asking about. And we will also be empathetic towards that question, because it's obviously scary to have a loved one that's sick and not knowing what to expect. And what we're highlighting is that we will also want to use our forecasting skills. So, for example, start with reference class forecasting. Ask yourself, what do we know about other people who suffered a similar illness, for example? What do the statistics tell us? And what do they not tell us? Or where are those statistics maybe biased? Like, what is everything that we can know about this? And then tailor that forecast to the patient in front of us. We can follow up that kind of forecast with a commitment to frequent belief updates. So communicating with a family member that this needs to be constantly updated, that forecast. Another skill that we mentioned was to not be afraid of precise probabilities.
I think it's a perfect primer in getting people excited, not only to hear the podcast, but to read the article. You give some practical advice, common questions that we get that can be hard to address, but I think having some type of a construct to approach these cases is so helpful. Claire and Bob, thank you again so much for all your work on this topic. Check out the podcast to hear the full interview.